skin. There is a practice of incising the penile skin either in infancy or by 10 to 12 years. This incision of the foreskin is known as circumcision. This incision of this foreskin is known as the circumcision. Penis has the skin, then this skin comes up to the corona grandis, means the neck of the glans penis. Then it is extended forward, and this is from the inner skin. This is attached with the inner skin. This is the outer skin, this is the inner skin. This is beyond the glans penis. This part is called foreskin or the prepuce, right? And on the dorsal aspect, you will see a frenulum. That is the site of fusion of the genital folds that gives rise to the formation of the frenulum on the dorsal aspect of the penis, right? Now so the prepuce is what? Prepuce is actually the double fold of skin of the penis. Double fold, right? Now during circumcision, what we do? We cut around just below the glans penis circularly and make stitches on the frenulum at the frenulum, and this cut part, the skin is stitched with the subcutaneous tissue. The skin is stitched with subcutaneous tissue where there is number one a loose areolar tissue and another is a tough membrane which is known as the Bach's fascia or fascia of penis. So what I have done a circular incision. I have done a circular incision at the level of the glans penis, just below the glans penis, that is corona grandis, right? Then I have stitched on the back, I have stitched the frenulum. I have stitched the frenulum which is on the ventral aspect, and then this cut margin is stitched with the skin with the superficial layer, skin with the superficial layer. This is the stitching of circumcision. But the thing is that when we will approach a newborn or an infant for circumcision or 5 to 7 years old a child, he will be very much afraid of it because there is torrential bleeding. There will be, when you put the incision, there will be torrential bleeding. So you have to stitch the cut area very quickly. Got my point? When you cut this area, there will be torrential bleeding. So you have to stitch from skin and the superficial layer beneath the skin very quickly and put stitches on the frenulum. Then you will put bandage scrotal make a scrotal sac for hanging the scrotum and skin, and you have to put under analgesic and propan. Analgesic plus propan, that is propantheline, that will prevent the contraction of the urethral tissue. That will prevent the contraction of urethral tissue. So, analgesic and the propantheline, that is propan. Propan 5 milligram. Normally it is given 5 milligram PD or TDS, right? And analgesic. This will make the baby stable. Now another thing you need to know is the contents of the spermatic cord. What are the contents of the spermatic cord? What are the contents of the spermatic cord? Anybody? Why don't you read in continuity? You should read in continuity. Otherwise, it will be tough to be able to memorize. Got it? The varicose veins that we see in relation to the spermatic cord is due to two reasons. Number one, as the left kidney is higher, so the blood from the vas deferens and the spermatic cord reaches delayed and under resistance, and this resistance is created due to the distance between the kidney and the spermatic cord, right? And in case there is the suprarenal gland, from the suprarenal gland there is the adinol. There is the adinol that comes out into that part of the renal vein where this draining vein, spermatic cord, veins of the spermatic cord draining vein communicates with the renal vein, and there is the release of adrenaline from the suprarenal gland. Due to release of adrenaline, there is constriction of this blood vessels, and so the blood from the spermatic cord is under resistance and it is flowing above under resistance. So there is formation of varicocele in relation to the spermatic cord. In relation to the spermatic cord, there is formation of the varicocele. The main reason is number one, the height. Number two, as it is passing in front of the, in case of left side, the left renal vein passing in front of the abdominal aorta, and the area where the vein from the spermatic cord reaches, that area is flooded by adrenaline from the suprarenal gland. So the area is constricted, and for this constriction there is varicocele in relation to the spermatic cord. Varicocele in relation to the spermatic cord. Now, so have you ever seen a baby with whose foreskin is long and cannot be retracted beyond the corona grandis? Have you seen a baby with a foreskin long enough, but if you cannot retract it back beyond the sulcus of the glans penis, that is corona grandis? Have you seen such a baby? Have you seen such a baby where you cannot retract the foreskin? You cannot retract the foreskin beyond the glans penis. When you are unable to retract the foreskin, then you have to investigate whether the foreskin is adherent, or it is constricted. Whether the foreskin is adherent or it is constricted. If it is constricted, then you need to incise it also. If it is constricted, like band-like, then you have to cut it also. And if it is free but unable to be retracted, then circumcision will do enough. corpora, corpus spongiosum, that is forming the crus of the penis. That is forming the crus of the penis. And in this part, the spongy part of urethra is passing up to the tip of the glans penis. And you see the skin is double folded at the level of the tip. It is double folded means one layer which is going outside the body of the penis, and another layer that is coming from the corona grandis. Two layers are attached together, and this is extended beyond the glans penis. This part is called the foreskin or the prepuce, which is sometimes tight or adherent to the glans, or tight, that is fibrous, and the opening of the urethra cannot be negotiated straight ahead. So there is a need of circumcision to cut out the extra skin so that the urethral stream comes straight first, and that's why we do circumcision. And religiously it is done to prevent balanitis and balanoposthitis. In some religion, it is believed that removing the skin prevents the glans penis from infection, and that's why they cut out the foreskin early. In our country or in any other country, the circumcision, if needed, circumcision is done at around some adult age. But in religiously practiced countries, the circumcision is done below 10 to 12 years in early infancy, right? Now, how do you examine a case of long prepuce? How will you investigate? What will you do to this case when the prepuce is long or adherent or band-like constricted? যদি prepuce-টা এরকম হয়, then do you cut, putting the scissor inside? Do you cut like this or in any other way? How do you cut the foreskin or the prepuce? How do you cut the foreskin of the prepuce? You start beginning at the frenulum, at the ventral surface of the penis. There is a site of attachment. There is which is called frenulum, like the under surface of tongue. There is a frenulum, like the under surface of frenulum. So we put stitches to the frenulum. Then around the corona grandis we put incision through scalpel. Then stitch skin and subcutaneous tissue, skin and subcutaneous tissue, skin and subcutaneous tissue. We stitch like this all around up to from the frenulum to again up to the frenulum. This is the method of operating on foreskin. This is the method of operating on the foreskin. There are some people who are not agreed upon to do circumcision. In such a case, what will you do? You can try to explain him or her, that this foreskin will get adherent and fibrous, and there will be problem in stream of urine that comes out. Then what will you do if they are not agreed in doing circumcision? What will you do if the family members are not agreed upon doing circumcision? What we do? We put the baby under local anesthesia and gradually dilate the foreskin. Gradually dilate the foreskin. Regularly we dilate the foreskin after taking some anesthetic gel over the forceps or the mosquito artery. You have seen mosquito artery forceps? Small mosquito artery forceps. So we take some anesthetic gel and enter the foreskin and gradually dilate it. Gradually dilate it. Following a week of regular dilatation, there will be release of the constricting band that was obstructing the urinary flow. Got my point? When around 7 days after, there will be release of the constricting band that was obstructing the flow of the urine. Now you can release the baby, telling his mother that the baby will not have further problem of obstruction of urine as the foreskin has been released. So it is not that cutting of the foreskin, that is the circumcision, is the only way out. It is not that the circumcision is the only way out. You can relax and release by putting some anesthetic gel regularly and using some mosquito artery forceps and dilating the foreskin, and this will be all right after few days, that is more than 7 days, it will be all right.